Okay, hello everybody. Welcome to the webinar, Workplace Strategies, Guidance in Times of COVID-19 in the Middle East and the Asia Pacific region. I am Wolf Kirsten. I am the co-director of the Global Center for Healthy Workplaces. We also have Tommy Hutchison here, who is going to be co-moderating with me the webinar today, who is the other co-director of the Global Center for Healthy Workplaces. So welcome to everybody, and a good morning, good evening, good afternoon. I think we have all time zones covered here, and we have a very diverse group from all over mostly the Eastern Hemisphere. So thanks again for joining. I would like to ask you to, during the discussion, or first of all, during our presentations, to mute yourself so we have no background noise, and you can always unmute yourself once you have a question. Then, of course, you can use the chat function. There's an icon on the top, and it shows up on the right side for you to ask a question, to make a comment, to share a resource. We usually have a kind of a lively discussion on the side, which works well. So share if you want or have questions at any time. So yeah, we have an exciting group together today. We have actually 5 speakers or contributors, if you will, lined up. It's the webinar is really designed as a information sharing session, and you know, in a rather informal manner, I would say. But we will have some slides, some presentations, because in some instances it really will drive home the point and the model or the strategy. So it will be helpful to do that. So as you know, we still are, unfortunately, in this crisis. And it's affecting the entire world. And we've had a couple of webinars. Some of you have participated, I know, with participants mostly from North America and Europe. We're really glad now to have a different time zone and get some more insight on what's going on in some countries, in Asia and Pacific, Oceania, and of course also the Middle East. So we're going to have some leading multinational employers, some government agencies, institutes who are going to share their strategies, on how to get employees back to work. First of all, talk about how the crisis is impacting their employees and their business and the health, of course, and then how to get employees back to work. What are some of the strategies around that, and how far along are you at the current stage? And then maybe towards the end, have a little bit of a view of what is the new working world? Where are we going to be maybe in a year or 2 or 3? How different will it be, and what will kind of survive, so to say, what we are facing right now? So yeah, I think we're ready to go. Like I said, we have 5 speakers, and I will be driving the show from here, from the slides from my screen, and I will start sharing. And I'd like to introduce our first speaker. And our first speaker is from Japan, Dr. Hiroshi Fukuda, and he is associate professor at Juntendo University and also heavily involved with the Sampo Society in Japan, which he will talk about and explain. So I will pull up the slides. I'm going to share my screen first and give the microphone or the floor to Dr. Hiroshi, please.
Okay. Good evening, everyone. Thank you very much for the slide. And actually, I promote to the project professor right now. Okay.
Oh, that's great! Congratulations. That's perfect.
Yeah.
Yeah.
Thank you very much, Wolf, and I'm very appreciated for your friendship, and I'm honored to have a presentation opportunity today. So, I'm Hiroshi Fukuda from Juntendo University. I'm a general physician and also an occupational physician in several companies in Tokyo metropolitan area. So therefore, today I will present the Japan situation from the perspective for both sides, general physician and occupational physician. Okay, next slide, please. Okay, next slide, please.
Just so you know, there's always a slight delay, but yes, I'm listening. Go ahead.
Okay, thank you. So everything is changed by this new coronavirus. The people life and working style have completely changed, I think. The next slide, please. And this is the number of the infected cases in the world today. So over 6 million people have been infected and nearly 400,000 have already died. Next slide, please. On the other hand, the number of infected people in Japan is 16,000 and the number of deaths is 900. Next, please. So I want to introduce some history in Japan. So the first case in Japan was confirmed on January 16th. The case was male, 30s, who had traveled to Wuhan, China. Next slide, please. At this time, Japan was not strict on travel restrictions from China. Japan is geographically close to China and has a lot of people exchanges. So Japan's non-strict policy had been criticized by the world, like this comic. Next slide, please. And around this time, the 5 charter flights from Wuhan to Japan flew. At the end of January, the safe return of employees was an important issue for occupational health. Next, please. And early February, it became necessary to respond to the cruise ship, named the Diamond Princess, at Yokohama port. It was so difficult, so many infected patients and dead cases there. Next slide, please. In those situations, Prime Minister Shinzo Abe implemented a policy like this slide. In early March, school closures, and from April 7, declared a state of emergency. This continued until the end of May. Next slide, please. And you know the Olympic Games have been postponed, and Governor Koike requested stay at home from the end of March. This isn't a city lockdown, much more mild measure. Next slide, please. But surprise, in Japan, it's successful. The city resident accepted the self-restraint, and the number of people on weekend was 70 to 80% down. Next slide, please. In addition, the governor of Tokyo has instructed the university hospital to expand the capacity of PCR tests and hospitalization bed. Next slide, please. It takes a great deal of effort to perform PCR tests. So in the March, the PCR capacity of our university hospital was only 10 cases a day. Next slide, please. But in April, a semi-outdoor, the fever clinic was opened. Next slide, please. The PCR capacity improved to more than 40 cases, and now more than 90 cases a day. Next slide, please. So infections around the world are still expanding, passing through China, Europe, and North America, and the current centers of infection are South America and Russia. The spread of infection in Asia is relatively low. Next slide, please. And cumulative number of the deaths in Asia, including Japan, is 100th of that in Europe and America. So very, very small number in Asia and Japan. Next slide, please. Why does Japan or Asian country have so few death cases? There is also the idea that infection control was successful, but there may be other causes that are originally low in infection. So Professor Iwasaki at Yale University considers the 5 reasons. One reason is the Japan lifestyle and culture that doesn't kiss or hug, such kind of thing. And other very powerful hypothesis is cross-immunity in the past. Maybe Japan or Asian people already infected, mutated, and old weak SARS virus, maybe, and so on. Next slide, please. So this is the overview of the Japan situation. The next, we show the impact of COVID-19 on occupational health. So next slide, please. The field is the Sampo Society. The Sampo Society, which I chair, is a study group for the multidisciplinary occupational health staff with a history of 30 years. The Sampo means occupational health. Next slide, please. The group usually focuses on incorporated case studies and good practice rather than lectures. Next slide, please. The monthly meeting in Maine is held online with about 80 people sharing the current situation and having discussion. Next slide, please. Before the monthly meeting, we conducted a questionnaire and received responses from 122 companies in various industries. The first question is, does COVID-19 affect corporate activities? So almost all companies says yes. Next slide, please. This slide showed response or countermeasure to COVID-19. You can see the setting up the response team or manuals, self-restraint of meetings or reduction of business hours, and promotion of teleworking and Zoom video conference. Common occupational health response was found in many companies. And it is very impressive that you can see below the four column that only 30% of the companies responded to actual corona positive cases. So this is show the current infection situation in Japan, very small number in Japan. Next slide, please. Next slide shows the concern and the troubles with COVID-19. Many were concerned about the prolonged lockdown and the negative impact on the business result. And the second most common issue was teleworking stress. Next slide, please. It was reported that BDT symptoms such as headache and eye fatigue appears in 30%, and the mental stress symptom in 40%. Next slide, please. So Dr. Wolf emailed me about teleworking issues on May 12th. So thanks to that email, I can present today that reason. So he showed me the British survey. The next slide, please. It showed the physical and psychological and lifestyle effect of teleworking. Almost the same situation is occurring in Japan, where lockdown is relatively mild. Next slide, please. So based on the discussion of the Sampo Society, I examined the pros and cons of teleworking. So you can see that there are many good things on teleworking, but on the other hand, both the bad things, and we can see many bad things in either. Next slide, please. So Ministry of Health, Labor and Welfare has issued a guideline for teleworking. The telework is expected to continue in the future in all the world. So there are some ideas for supporting teleworking from discussion at Sampo Society. For example, we will also need a new service such as online counseling or online and exercise supporting. Next slide, please. So last part is the workplace health promotion with corona. Next slide, please. On the May 25, the Prime Minister Shinzo Abe lifted the state of emergency. The next slide, please. The government proposes a new normal lifestyle for the infection control. The next slide, please. The common sense up to now will change. For example, the meaning of wearing mask has also changed than before. Next slide, please. So Japan has promoting health and productivity management since 2014. This is a kind of workplace health promotion. Next slide, please. In that management, improving the health literacy of an organizational health literacy is a key factor for success. Next slide. In workplace health promotion in Corona era, support for improving employee and the organizational health literacy against unknown infectious disease is very, very important. Next slide, please. So we reported continuous workplace health promotion enhance the health literacy in an ICO in Dublin. So next slide, please. So this is the last slide. So this is, it is important for employees to not blindly believe in media information to improve their health literacy and to discuss and consider whether they and their family and their colleagues can be safe. Okay, sorry for too many slides. Thank you for your attention.
Thank you so much, Dr. Hiroshi. That's a very good presentation, and also with the time, the limited time that you had. So thank you very much. And I'm sure there will be some questions coming up pretty soon. So we're going to move it from Japan to India, and I would like Dr. Raj Gopal from Unilever. He's the corporate medical director of Unilever. I'm going to pull up the presentation. Dr. Raj, I should mention that Unilever is a Global Healthy Workplace Awards winner, and actually in several instances in several countries. So it's done a lot in this area. So please, Dr. Raj, the floor is yours, and I'll pull up the presentation while you start.
Thank you, Wolf, and good day to everyone. Indeed, I'm lucky to be speaking to everyone today because yesterday we were expecting a huge cyclone to hit Mumbai. And mercifully, at the last minute, it changed course and fizzled out. So sometimes things do work out well. I'm sorry that I'm not able to start my camera for some strange reason, but I would actually like to speak to you in the next 10 minutes or so about the Unilever return to workplace philosophy and how are we planning for easement. Can I have the next slide, please? If we actually look at the way in which we approach getting back to workplace, as many countries are slowly relaxing the various curbs, we look at it through 4 lenses. One is the WHO lens of when do we actually advise people to come back. We look at it from an internal Unilever lens. We also see what are the local government regulations in terms of getting back to work and in terms of the employees themselves. How fit and how able are they to get back to work, and whether they have any issues, whether they are vulnerable or have any other issues. Our 4 principles which guide us while getting back to work is people safety is our #1 priority, and we are led by our purpose and culture in all that we do. We would like to apply prudence and not jump into it straight away, and we want to protect business continuity by embedding the new ways of working in all that we do. Next slide, please. So when we look at the easing or the gating criteria, as we call it, the first gating criteria is the health indicators. We look at both internal and external health indicators. While this is a busy chart, I'll just try to tell you what are the criteria which we look at. We look at the WHO transmission status. Right now, in many parts of the world, people would be having a community transmission, and we call it as the highest tier or tier 4, where we don't want people to get back to work. The next one is the cluster of cases, where you would have a number of cases, but attributable only to clusters which occur in some pre-designated or designed places, whether in communities or amongst migrant workers or stuff like that. Then you have sporadic cases and no cases. We also try and see if there is an available published R0 or the reproductive factor of the virus. Wherever the R0 is more than 1, we would prefer not to get back to work because the infection is still spreading in the community. And then depending on the other R0s, wherever published, we look at that. If we don't have data on the R0, we just go by the WHO transmission status. we need to satisfy 4 criteria before we believe that it is safe to get back to work. The first is that the trajectory of cases, they should be coming down in the past 14 days. The trajectory of deaths, they should also be coming down in the past 14 days. And when you look at the hospital capacity, it is okay for the hospital to have some degree of strain, but not okay if we are not able to get a bed or able to get an ICU. So in tier 3, we would believe that hospital capacity is under strain with the cancellation of the most non-urgent surgical care or whatever care is needed for hospitalization. When we go down to tier 2, there is more increase in terms of hospital bed capacity. And the fourth thing which we look at apart from cases, deaths and hospital capacity is the ability to test. As the proportion of testing goes up and the proportion of people testing positive comes down, we are far more inclined to let people to get back to work. So those are the external health indicators. When you look at the internal health indicators, we look at employee cases, employee sickness, absenteeism, and employees staying away either because they're vulnerable or because they have some signs and symptoms and want to be in quarantine. And I'm sure these slides would be distributed later, so I won't go into the details of all, except to state that from tier 4 to tier 1, we have very specific health indicators or criteria which we want to look at. Next slide, please. Thank you. We also look at the market indicators. So what are the market indicators we look at? There are two key ones. One is the public transportation, and the other is about social gatherings, in terms of what's happening to malls, in terms of business, in cinema, refreshments, opening of all these places in terms of social gatherings, schools, etc. And then we try and decide whether it is wise enough for us to actually come back. Again, for each tier, we have got a set of criteria. The underlying principle beyond getting to work or getting back to the workplace is that, first of all, the government should have eased off. We don't want to jump the gun and get our people into work before government eases off. And after the government eases off, we have a clear 3-week cooling period, because very often we find, like in other countries, whether it is Germany or elsewhere, people get back to work, suddenly there's an increase in the number of cases and you have to go back home again. So we don't want this yo-yo between different tiers, and therefore we have a cooling off period of 3 weeks once we sign off. Now, countries which want to get back to work have to make a formal application to the Global Incident Management Team, which is chaired by our CEO, identifying each of the factors which I have mentioned, whether health indicators or market indicators, and why they should be allowed to get back to work. Now, this is judged on a very, very objective manner, and people who are then given a tick in terms of, okay, guys, you can get back to work, then wait for 3 weeks before getting back to work. Next slide, please. So if you actually look at a summary of the entire thing, the overview of the easement criteria and tiers, from tier 4 to tier 1, it starts from a risk which is very high going down to a risk which is very low. So we have a combination of factors, like I told you, the R0, the WHO status, deaths, cases, testing, and hospital all considered, and combined with what is happening in the society around us, whether in terms of public transport or in terms of other market factors, as I mentioned. Next slide, please. Over and above all this, we also want to ensure that the workplace is ready to welcome people. So there are various aspects, and obviously because of time, each one of these has a detailed plan. I'm not sharing with you, I'm only sharing the top line. You need to prepare the building for receiving people, whether it is in terms of seating, in terms of social distancing, in terms of protocols. You need to prepare the workforce when they come back. We would have a thermal screening at the beginning. They would have to give in a signed declaration stating that they have not suffered from any of the current symptoms of COVID-19, nor are they suffering like cough and fever, breathlessness, recent loss of smell and taste, and all this. Control access will be given only to those people whom we believe are necessary to come back. We have a social distancing plan where we ensure that people are at a distance of 6 feet from each other. For all people coming back to work in tier 3, we make mask wearing as mandatory. So we don't believe that if you can maintain a social distance of 6 feet, you won't need a mask, because you don't know when people are getting closer to each other. And there is enough evidence now to prove that if somebody coughs or sneezes, while the big droplets fall down, the small droplets will hang around in the air for some time. And if you are walking around without a mask, you could actually be in sort of a danger. Ideally, the trio of social distancing, wearing mask, and hand hygiene is the best chance of ensuring that you do not actually get infected with COVID-19. Then we want to reduce the touch points in the entire workplace and increase the cleaning. and most importantly, communicate for confidence. So this, ladies and gentlemen, overall is the preparation which we are making. Next slide, please. And I would just like to conclude by saying that we are very, very conscious of the fact that there would be pressure in terms of getting back, either from the peers or from the industry peers or from the employees. There are many people who are actually fed up of working from home, and that's the truth, and they want to come back to a familiar environment. Though the new norm, I believe, would be that it's going to be a judicious mix of people working from home and working from office, but we want to ensure that we provide the maximum amount of safety and comfort for our employees. And that's why this entire protocol has been drawn up. Thank you, Wolf.
Thank you, Dr. Rajgopal. I like the Safe Six. Very nice. It's really, really good strategy, and I'm sure we'll get some questions on that end as well from our participants. So our next speaker, and I'm not sure. I have to check here. Yes, Simon, if you are on, Simon Lim from the Health Promotion Board Singapore. If you're on, give us a note and unmute yourself. I think you're on the participant list.
Yes, hi.
Wolf. Oh, great.
Yes,
yeah,
Simon here.
So,
can you hear me?
And yeah, we can hear you, definitely. Just quickly.
That's great.
In
Go ahead. Okay, yeah, right. Thanks everyone, and hello friends. I thought I don't have a deck of slides, but I thought I just wanted to share how Singapore is moving back into this new normal as we are trying to get things back, the workplaces all back in place, and also the community all back. We had a period of we call it circuit breaker, all right, in a way to try and prevent any transmission. We had quite a bit of a kind of a lockdown, but not exactly a term that we use. We call it a circuit breaker to try and get everybody to work from home. Quite a strong restrictions in terms of the population, not being able to then move around freely, and that is really to prevent a further spread and to have like a kind of a circuit breaker. So I thought I just wanted to share what Singapore is doing in terms of trying to bring this normalcy back. So and how we are trying to work through the community and the workplaces. All right. So there will be this nationwide, we call it COVID-19 testing strategy that we are being developed, which will involve a very comprehensive community surveillance, so that we are being able to better detect any unlinked cases in the community. The whole purpose of this nationwide testing is really threefold. Firstly, to find those who are COVID-19 positive early, so that we can prevent potential cluster from forming at the community side. Secondly, also to conduct this surveillance to understand the overall transmission landscape. And thirdly, really to look for those who are negative and to allow them to get back into the workplaces and also to the community. So testing in Singapore will be prioritized for priority groups. We identify the high risk and the more vulnerable groups, particularly those seniors living in the nursing homes and healthcare workers, all right, with very high touch points with the community. So those will be the very high priority that we will do this testing. We will then progressively expand to other essential workers and the broader community. That's very much in line with the expansion of our testing capacity, all right, to allow these essential workers to be tested and then for them to be able to then get back into the workplaces, all right. Among these top priorities, as I mentioned, the nursing homes, the frontline medical workers in the hospitals, and a big segment will be the migrant workers in Singapore. And I believe some of you may have also heard that we had a very big outbreak in the migrant workers that is working in Singapore. And we want to do a very regular testing, all right, on this group, so that they are safe at work and also when they get back into the community. Just to highlight that recently we just completed a mass testing exercise for the preschool staff. and the international preschool and kindergarten staff, comprising some 40,000 preschool staff in total over a 2 weeks period. And in our mass testing on this preschool staff, we found about 0.06% of a low prevalence of COVID-19 positives from this exercise. And we managed to detect these positives staff early before the school reopens. All right, then this also is critical to prevent a transmission. All right, when at a preschool site, especially when there are young children returning back. All right, when the school reopens, and this also pose a problem if these children also brings this virus back to their homes. So this mass testing exercises that was conducted at the preschool was critical to provide public confidence and also parents to be assured to allow their children to return back to school. Coming up, we will be also embarking on another major mass testing exercise to focus on the essential workers that will be resuming back to work soon. As I said, these are the migrant workers, construction site, marine, manufacturing industry workers. And the recent outbreak that we had at the dormitories where these migrant workers are staying form around 85% of the Singapore's total COVID-19 infected cases. All right, and largely these are because of their close living and working conditions in the dormitories. While the situation is more stable now and controlled, well, the government is stepping up 100% testing of this group of migrant workers. And the intent is to prevent transmission in the community when these workers return back to work. So we are working very closely with all the agencies, all right, to meet this nationwide testing as the new normal in this COVID-19 pandemic situation pans out. Well, Singapore is also actively using technology to strengthen this health monitoring and health surveillance of the workforce. We use teleconsultation services through mobile phones to provide health status timely and efficiently to the community so that these healthcare workers can focus to treat the COVID-19 patients. We have also implemented a mass contact tracing mobile apps that supports Singapore's efforts to mitigate spread of the virus through an expedite community-driven contact tracing. Having said all this, one of our challenges in this nationwide testing will be how we can source for more test kits, both locally as well as also internationally, that we are looking at for procuring these test kits. This is to allow us to have more capacity to do this nationwide testing. And Singapore is trying our best to scale up this testing capacity from the current 8,000 tests daily to about potentially 40,000 tests daily, all right, in this nationwide effort. And we know there's a global shortage of these test kits as every country is also moving towards mass testing and materials required to conduct these tests, all right. And we have to ensure that we have a continued supply and stock of these materials to allow us to continue to sustain this high level of testing. The other challenge we have is also the manpower needed to carry out these testing operations, particularly swabbing of the patients, serology teams that we want to also test the patients, as well as also the processing, documenting, testing the samples and recording the results at the laboratories. So all this requires capacity at the laboratories, and there will be also infrastructure and manpower requirements at every stage of the test. So I think these are some of the things that we'll be doing as we get back into this new normal, all right, post circuit breaker and also in the COVID-19 situation. So this testing will be a national resource, and we will then have to apply this in a strategic way to ensure that, well, Singapore is safe from this virus. Yep, that's all I have. Thank you.
Simon, just before we hand it to Dr. Mansoor, just a quick follow-up question on my behalf. Give us a feeling for how many employers are getting their employees back to work. Is it like full on? Is it very early? Is it half, or what? Just give us a feel for how many companies are really now trying to get their employees back to work or not.
Yeah, so we are moving back into the normalcy in phases. The primary phase now in phase 1 is really the essential workers. And if you ask me, these essential workers probably takes up about 20% to 30% of the workforce, all right, that we want to do mass testing. So once we clear them from the testing and they are all cleared, we will then bring this 20-30% of the workforce back into the community. And these are all the essential workers. In phase 2, we are also slowly bringing back the rest of the workforce. That will comprise potentially another 30 to 40% to back to their workplaces physically. And the rest of the companies, we hope they can continue to still work from home. So I think the new normal will be a case of maybe a 50% of the workforce will work physically in their workplaces, and the other 50% will have to continue to telecommute from home. And that is really to prevent and minimize overcrowding of these of people at the community.
50%. Wow, that's a very interesting number. Like ongoing. Yeah, that's great.
Yeah.
Fascinating.
Yeah. Yeah, everybody is trying to work through this new normal and trying to work from home. And I think technology plays an important role. In fact, for the last 1 over month, when we were in this circuit breaker phase, we were all communicating from home through technology and all. And I think people are now getting used to working from this kind of alternate mode. Yeah.
Yeah.
Thank you.
Yeah, thank you so much, Simon, for that update from Singapore. I should mention Simon is the Director of Workplace Health and Outreach Division for the Health Promotion Board, which is part of the Ministry of Health in Singapore. And they've been a long-time proponent of workplace health promotion and doing some excellent stuff and working closely with companies. So I just wanted to give that added perspective there. So thank you very much. So
thank you, Wolf. Thanks.
Yeah, thanks. Let's move on and invite Dr. Mansoor Habib from Dubai to address us. And Dr. Mansoor is a dear friend and colleague, and he is the head of happiness and tolerance with the Emirates Integrated Telecommunications Company, also known as DU. So, Dr. Mansoor, please unmute yourself and go ahead.
Hello, everyone. I hope you can hear me. So, good morning, good afternoon, good evening, wherever you are in this planet. And it's fascinating because I think I'm the first presenter today who's talking to you face to face. Some of you had presentations, so I'm not sure if this is the best thing, but let's jump in. Okay, first of all, thank you so much for having me today, Wolf, and everyone around. I'll take us through a very quick cruise in the things which happened in our country, United Arab Emirates. As you know, we have 7 Emirates, 7 different cities in the country, and I'm from Dubai, one of the major cities in the country. The story started back in end of February, beginning of March, when we started getting more and more alert about the COVID situation. Obviously, since January, the thing was going on, and the WHO started giving us the advice about the social distancing and other measures. But things started heating up when we started noticing our first few positive cases in the country by mid-Feb, end of Feb. Hence, from thereafter, the country started embarking into a phased approach of working from home and mobilizing people out of their offices to home. They started with reducing the capacity in restaurants, encouraging work from home, not mandating it, but encouraging it, closing areas of mass gathering, because as you know, we are in a country where social connection is a very strong fabric of our country, which imposed a huge challenge on us, because our families might be of 5, 6, 7. We have extended families living together. We have our rituals, the daily one, like going to the mosques and other gathering. And especially we were coming towards the month of May, which is the month of Ramadan in our country, where social gathering is the majesty of it and the prayers and everything. So things were really challenging and very interesting for us from that perspective. So the country started with a phased approach in March, closing the mosques, closing the cinemas, reducing the capacity until April. By beginning of April, they went into a complete lockdown for a period of 3 weeks. Now, some cities went into complete lockdown. Some of the cities were in partial lockdown. The reason behind that was because one of the unique things about our cities is that we have a good percentage of migrant workers which live in shared accommodations. And having said that, as you know, shared accommodations is one of the big risk factors for the spread of the virus and the infection across big societies. So the complete lockdown rationale was to go for a mass surveillance screening through those major high-risk areas, as well as it allowed us to build field hospitals and drive-through screening options. So what happened across the country, we had multiple stations and setups where you come with your car, you put your ID, you get a previous appointment, and then you do your test, and then you get with the PCR, and then you are given the result. And on the other hand, field hospitals were established in some of our convention and centers to accommodate any large or sudden increase in the severity or in the cases. I mean, I think we are somehow lucky. We might have some common genes with Japan. The total cases so far we have is around 36,000 out of our 8 million, which comes to around 0.4, 0.5% from total population. And the death rate is, we have only 270 declared deaths so far from the beginning of the crisis out of the total population. Now that differs from maybe one country to another or from one city to another, but that's the lump sum that we get it declared from our national crisis. Because what happened at the beginning of the crisis, we had a national crisis team set up across the country, which was liaising between different cities in terms of regulations and in terms of closure and so on and so forth. At our company, the telecom operator we have two major telecom providers in the country. We are one of them. We went a step ahead of the game. We started pushing to work from home and all the different measures from beginning of March rather than mid of March when the government started pushing and encouraging that. So from beginning of March, we immediately put in place certain measures, and that allowed us to push our people. And we were lucky enough not to register any case among our staff or partners or vendors during that period, during the month of March. I think during the whole month of March, we did not register any case. It was maybe beginning of April where we started noticing our first few cases being registered. And most of them, if not all of them, were working from home. But then obviously, because we are a telecom, we have retail, we have field engineers, and some of the cases were among those ones. But then, as you know, the challenge with COVID, you cannot trace it back that because he came to the office or he went to the field, he got the infection. It could be from the shared accommodation he or she is living in, or it could be from the delivery boy, or it could be from going to the grocery. There are so many different reasons. So to trace it, it would be unfair to say that the workplace was a risk for that one. But because we did not get any cases within our workplace, that gave us some kind of an insight that the right thing was done at the right time. During the month of April, after the end of April, the lockdown was eased because we went into the month of Ramadan, and then it was a partial lockdown from 10 p.m. onwards, and the measures of working from home continued across the country, across the government, until we reached to the last week of May. During the last week of May, it was the Eid holidays, which we celebrate after the end of Ramadan, and the government announced that we will start going back gradually to work, noticing that the number of cases are stable and the number of critical cases are very minimal. So this gave them some comfort that we're going to go back, but it will be a gradual return, as per se. And as mentioned, because we have various cities, different cities had different local regulation. Some of them started with 30% back, some of them started with 50% back, with applying the social distancing and all the various measures. The interesting part for us as a telecom operator, what we had an opportunity to do is not to be obliged fully by the mandate, because we are considered as a semi-government setup. So we were given the opportunity to decide when we come back to work. So we had a very different plan than the rest of the country. Before I go into that plan and give you a quick insight about it, I'll give you two things which we did during the lockdown and during the period of working from home. Until today, our people are working from home. But at the beginning, when we pushed people and we encouraged them and we mandated them to work from home, first of all, we circulated a survey across our company to look at about the behavior, about what people are liking and disliking about working from home, what support they need from us. And we found some interesting insights. I've shared that previously with Wolf, but I can take you very quickly through some of the percentages. So out of our sample, 86% said that they feel calm and relaxed. 28% said that they find somehow reduced work-life balance because of being attached to the device and to the community and the connections and the emails, because there was no morning and evening. It was just a full pack of day. Some of them, 26%, stated some challenge in communication with coworker and others. So we were picking up on those challenges and we were enhancing it. 23% said we require better IT tools. 24%, which was interesting, said we need office furniture at home. We started getting many requests of individuals asking us for office furniture to be taken to their home. So we advised them that we can provide you with some discounts, some options, and we supported them through our suppliers with various options. Some of them were afraid about the job security, especially, as you know, in our country, 80 to 85% are migrant workers, rotating workers. They come with a certain working contract, and if their working contract or their stay in the country or the visa expires, then sometimes they are at risk of leaving the country. But the country was very proactive, and they said there will be no one touches any employee until it's really, really necessary, and there has to be a justification going to the government. So that gave a lot of comfort for our staff and for our colleagues and families that they are in safe hand. And the country as a whole, being a very tolerant country and having more than 200 nationalities, we're very vigilant and very mindful about not impacting their workability. Some of the sectors got impacted, but we were among the lucky ones that we kept off all of our staff without laying off any of them. Some of the other comments we got is that people are feeling more productive. They are finding meetings more effective, because beforehand, when you are in a meeting, people will come late by 5 or 10 minutes and they'll tell you, sorry, I'm late. But now they're coming literally at the time on WebEx. Very quickly, going back to return to work, because I know we are running out of time. We had our own recipe, as I mentioned to you a few minutes ago, and we decided the country is using the 50% and the 30%. We said we're going to go back with 15% only. And we said we will decide to proceed back with 15% only for critical jobs after all the measures is in place. Similar to what my colleague has mentioned, what Unilever has done in terms of their measures, we more or less we have the same measures matrix and the same trigger matrix, where we are ensuring we did some site visits to the company, to the premises, ensuring that we are not missing anything, because employee safety is the #1 red line for us. Having said that, even that 15% which we are suggesting for our people to go back to work in the next few weeks is subject to assessment. Yes, we have very little cases registered so far, but again, we don't want to go into the yo-yo situation where we go in and then again we get cases and we come back. Although, again, my rationale as leading the crisis and the well-being department in the company is that we cannot trace what is the reason. Even if they start coming to office and they got the infection, it doesn't mean because they came to the office. Maybe they are meant to get the infection. So there is a very interesting debate and perspective in how we can position things. Obviously, social distancing, mask, and hand hygiene is the #1 safety measures. But then with our society, as I mentioned, they are very socially coherent. They find it very difficult to be far away from each other. You see them after a few seconds joining together, especially at lunchtime or at breakfast time, and then you have to push them to be far away from each other. So having said that, it's a fascinating journey that we are embarking in. We are exploring various options, and one of the some of the few things which we did and we are doing until today, we have through our clinic, we have a clinic in-house clinic. We have a hotline for our staff and their families. We have provided them with the counseling services and an employee assistance program. We do a weekly pulse survey to our staff to look at how they feel and what is their mood about working from home and picking up on certain challenges. Even we have a WhatsApp line through our nurses, which will accommodate our people requirement. We will deliver the medication of chronic patients to their offices, to their homes, and we will try to cater as much as possible, as well as we have a teleconsultation services via our insurance provider, which allowed our people not to need to visit the hospital unless if it's really needed. So this is in summary a quick journey of what is happening at the moment in the country. And obviously, at the time of questions, I'll be more than happy to receive your questions. Thank you, Wolf, again for the invite. It's really delightful to hear the other country experiences as well.
Thank you, Dr. Mansour, so much for giving us some insight from the Emirates. Again, fascinating and good to hear, and also about your leadership with your company. It's very good. Before I hand it over to our last speaker, I do want to remind you that we have 90 minutes for this webinar, so we will have discussion, and hopefully you will stick with us for the whole time. So please, Dr. Shrinikat Mishra from Hero Motorcorp from India, also an award, Global Healthy Workplace Awards winner, actually from last year. Please, the floor is yours, and I will pull up your presentation.
Thank you, Wolf. Thank you for inviting me to this event. Good morning, good evening, and good afternoon to everyone from whichever part of the world you are. It's my pleasure to be honored to be among these distinguished speakers from international and national repute. Dr. Rajgopal is an inspiration and a role model for occupational health physicians in India, and I also admire him. So, next slide, please. So these are the contents. Next slide, please. So this is the country overview. The total cases till 3rd June are 2,07,615, and active cases are 1,01,497. Total deaths is 5,815, and death rate is 2.8%. The recovery rate is 48%, and the testing cases positive has increased to 6.2%. So the first case in India was detected on 30th January. Until March, we didn't had any other case. And from 25th March, government decided to have a lockdown. So cases was increasing, and government decided to have the first lockdown from 25th March to 14th April. And then they kept on extended till 3rd May. Then the pressure was from the economic front, and government started to ease the regulations, and some industries were allowed to open with lots of conditions. There was a big issue of migrant laborers who lost their jobs due to the lockdown, and they wanted to go back to their home states. So they were stranded, and there is a human psychology that people want to be with their families during such situations. So there was a big issue. Even movement was restricted. Interstate travel was also banned. There was nothing to travel. All buses and trains were stopped. So that was a big issue, and government realized this and started now easing all the regulations within a staggered manner. Till 30th June, most of the activities will be open. Some containment area there is still lockdown, but most of the country state governments had been given orders to manage their states and make their own rules, and the guidelines has been provided by the central government. So most of the states are following their guidelines, but in the states where the cases are more, they are having more strict guideline, and the states where the these cases are less, they are moving towards more economic activities. So, and the 50% deaths are over 60 years persons, and 28% of the positive cases are asymptomatic. So this is the situation in India till 3rd June. Next slide, please. So this is related to my organization. So the work from home is a very new thing for my kind of company. Like, we are a manufacturing company, world largest two-wheeler manufacturer, and so most of our activities are situated to the manufacturing units. We have 6 manufacturing units in India, and outside India, 1 in Colombia and 1 in Bangladesh. We have some offices in Europe and North America, also in Africa. So, and we have 1 R&D center in Germany near Munich. So these are like offices. There were no issue to work from home, but for the manufacturing units, people can't work from home. So, like, as a proactive measure, our CMD decided to close all the manufacturing facilities before the government order to lock down. So government ordered on 25th, and we decided to close all the units from 23rd March. So that was a very proactive measure by our CMDs here. Health and well-being of the employees is a top priority for our CEO, and he has been regularly interacting with all the employees, all the stakeholders, dealers, supply chain partners, investors during the whole this lockdown period. And he has been telling stories, positive stories to boost our morals, and he has been very positive throughout this lockdown period. Almost every week he has been interacting with all the stakeholders, and this has been a very positive message for all the stakeholders, even dealers, our supply chain partners, investors. They are very happy with this gesture of our CEO. So we prepared a restart manual for the whole organization, and a special focus was the workplace safety, employee safety, well-being, all the procedures, policies, best practices from around the world, and government guidelines we are incorporated in our manual. And we did several innovation at our workplace to ensure that the hygiene and health is protected. So redesigning of the workplaces, almost all the processes were tried to be contact free, like no biometric attendance, everywhere contactless, this hand sanitization, hand washing facilities without touching, all sensor based or foot operated designs were introduced. So our workplace has been almost changed, has seen a large change in the practices. The working from home for the people, mostly white collar people, was a new normal. Regular online meetings and this webinar was a new thing. Some people find it more time consuming than working in the routine offices, because there is no time to work from home. The people start early, and maybe late evening they are working through meetings or online discussions. So this is for some people work from home may be good, but for some people don't like this. They want to be work as a normal routine office job. There was one more big gesture from our CEO, that no employee salary was deducted, even they were not working in the plant. No contractor, no temporary worker salary was deducted. All we are paid full salary, even without work. We provided insurance coverage to even the contractual worker who did not have any social security insurance. So company made this provision to have this medical insurance for all the people. Next slide, please. So we started with opening of manufacturing unit, staggered. Some state allowed us to open our manufacturing units in some places. So from there we started, and slowly now all our manufacturing units had started working. Our offices are still, some of the offices are not open, but slowly, like first lockdown, after first lockdown, the government allowed 33% of workforce to be working. Now they have allowed almost 100% of workforce in most of the places. There is some places there is a time restriction that night shifts are not allowed. Only in the day from 7 a.m. to 7 p.m. Working is allowed. So these are some restrictions. For employees, we during the lockdown, we provided this online health care services. We have tie-up with many partners. So this main focus was on this online consultation, and mental health issues was a big issue. So we have a EAP partner through which we provide online consultations to all the mental health, psychological health issues to the all employees and their family members. We also extended this facility to our dealers and other partners. So as per feedback of our EAP partner, the utilization is usually around 3 to 5%, but in this situation, this has gone up to 15%. In some cases, it is between 15 to 20%. So this is a indicator of this, how people are having mental health issues due to this coronavirus. So, like I said, that we are much focused on this workplace safety, and also educating our employees to how to conduct in society, how to be at home, how to be and in the market. So what do's and don'ts we are sharing with them regularly through all the mediums, like through email, through posters, through WhatsApp messages. So we are circulating these to educate our employees. Even the employees who are not having smartphones, we are playing this videos during the lunch hour or during the tea breaks. So this was the, so all the employees, we are office employees, we are working from home, and this temperature screening of the all employees are being done without this touching. So we have installed cameras, whole body scanning cameras, IR detectors, and also the attendance process is a whole contactless. We have developed our own health apps, like a health declaration app. Employee has to declare their health daily through a mobile app. Then we have a Hero Hope app, through which like contact tracing can be done for any positive cases, people who come in the contact. So it is a very easy to detect through Hero app. There is a Arogya Setu app by Government of India. This has been made mandatory for all the employees. So this also helps in detection of the contacts of the positive cases. So we are also following all the WHO guidelines related to workplace. Next slide, please. So the key challenges for our kind of manufacturing industry is employee return to work is a very difficult thing due to the non-availability of public transport. There are no trains, no buses, no taxis. Slowly they are starting, but as a caring organization, we have not allowed anyone to travel in the public transport. Only the people who are having their own personal transport, they are allowed to come to workplace, or the people who are getting transport from the company, they are allowed to come to work. No one is allowed to travel through this public transport for the safety reasons. There is availability of this temporary workforce is very low, because the migrant workers are left to their hometowns, and they have no option to come back because of travel restrictions by local governments. So some states are not allowing to come to their state, the migrant worker. Also, there is a policy for quarantine. Suppose somebody travel from one state to other state, then he has to get 14 days quarantine period, or at some places 7-day quarantine period. So this is a like situation. So the workers also very fearful about contacting disease during the travel. And there are lots of mental health issues. Like I told you that the cases has been 15 to 20% mental health cases has increased. So this is also big issue, because of the uncertainty about jobs, wages, and livelihood. There is an impact on our supply chain also, because supply chain, most of the parts are supplied by our vendors. So their condition is similar, that they are dependent on this temporary workforce and this migrant workforce. So the availability of workforce is the issue. So they are not producing the components, and we are facing this supply chain issues. Also, there is a fear that some positive case is detected at workplace, then government authorities come and then workplace is closed for some period. So there is a loss of business, loss of productivity. So this is also a big issue. Next slide, please.
Dr. Sriniket, I just wanted to remind you we're close to the time limit, so if you could please wrap up, that would be great. Thank you.
Okay. I will close it. I will close in 5 minutes.
Thank you.
So these are some issues about the coronavirus.
Could you repeat that, please? Did we lose them?
Sorry.
Okay. You could wrap up, would be great. Go ahead.
Yeah. So these are some of the issues you can see on the screen. Due to the lack of time, I will not describe much. The next slide, please. So the main healthcare issues are that testing is very low compared to the developed countries, and the testing errors are very high in India. Like I have seen many cases from our employees, they're getting positive reports, then retesting is done, then negative reports come, and this causes too much confusion in the workplace and the families also. This causes too much confusion also. Whole family is weird, and the people who are working with that person, we try to do contact tracing and direct contact and secondary contacts like become almost 100 persons. So 100 people are like identified that they are primary or secondary contacts. So all people are become tense that if he is positive, I may also be positive. And in the end, the result, second testing is done, result comes negative. Then for 2-3 days, the whole situation is very bad. So this is a big issue for the workplace. And the government is easing the lockdown, so people are feeling that after the lockdown, this corona crisis is over. So they are like having this social distancing and other things are like not following very much in the society. There is a big stigma in the society. Like somebody is found positive, that people don't like to visit him or even talk to him. They become like untouchable. Even family members, they don't care, and everyone like try to discard this person, and there's no empathy, compassion for the people who are being affected. So this is a big concern in the society. Next slide, please.
Okay, are you
So these are the national strategy, the health ministry strategy. So I have taken this from the health ministry website. Apart from this, there's an economic strategy. There's a big stimulus package has been announced by the government of India for all sectors, farming and SME sectors. So the banking sector, everything that they have announced a very big package for dealing with this economic crisis. Next slide, please.
Dr. Mishra, we're actually getting very bad feedback from your audio. So could we just make this the last line, because we are getting too bad feedback. It's not working, I'm afraid.
Now it's okay? Is it okay now?
No, it's not good. It's been constant for the last couple of minutes. So just wrap up, please. And we do have.
Okay, so this is the last slide. This is our organization strategy. The health and well-being is the topmost priority for our organization. Maximum employees should work from home if they are not required to come to the manufacturing units, and supporting employees in all kind of their mental health issues, and wellness issues. That is one of the priorities of our organization. Under the CSR, we have given around 1 billion rupees. This is a typing error, not 10 billion, 1 billion rupees to Government of India for various CSR initiatives. We are providing full salary to all our employees, whether contractual or permanent, and also supporting all our business partners during this event. Like our CEO has announced many financial and other incentives to our dealers during this crisis. Next slide, please.
I'm sorry, there's too bad feedback.
Thank you.
We'll have to stop it.
so while
Thank you. This was the last slide.
Thank you, Dr. Shriniket, very much for the excellent presentation. I'll hand it over to my colleague Tommy to facilitate the discussion. And I do want to throw up our Healthy Workplace awards are open at the moment. So as we just heard from 2 award winners, but Tommy, take it away.
Thank you. Yes, sorry, and Dr. Mishra, maybe if you could just turn off your audio, because we are getting very bad feedback on it. I do apologize. Thank you. So thank you for all the presenters and of course Wolf. We have some brief time for questions. I think we've got one from Jane Gardiner. Jane, if you're from Lend-Lease in Australia, Jane, if you're still with us, perhaps you could ask your question on mental health, or indeed I can read it out. Perhaps one of our earlier presenters might be able to take it.
Thanks. Yeah, I'm still here. I was just wondering how companies are supporting their people's mental health during this time.
Thank you. Maybe Hiroshi, has it been an issue in Japan? Mental health, workplace?
Yeah. So what is the topic? So mental health support from company in this situation?
Yes, and has it been an extra problem as a result of coronavirus? Then how many steps you're having to take as a result?
Yeah, it's now starting support. So just starting an investigation. How was mental health or physical problem in the teleworking, and after we take the data, the company maybe, and based on the data, they can provide some kind of online counseling or online physical activity program or such kind of support. Maybe it could be. It does make sense.
Yes, I think so. Yes, thank you. We've and there'll be a little time for others to come in if they want to follow up, of course. I'd like to take one from Nada Kumar Pillai from the Qatar Foundation. RTW and Nanda Kumar, are you with us still?
I'm here.
Yes, please.
Hello. My question is regarding return to work and the clinical vulnerability scoring systems. I've seen a few online, but I don't think that serves the purpose. But would you like to recommend any particular scoring system like our QRisk score calculator so that we can incorporate that in our overall risk assessment, and we can say this person is having high risk, so don't return to work, work from home. And with the slightly higher risk, okay, you can have a staggered shift, or if the number of persons working in the office is less, you can come over. And but you don't use public transport system extra. But and persons with minimal risk can be brought back to work, like we have to live with the COVID, and so they can participate in the normal activities. So do you have something which can be incorporated in our assessment? Thank you.
Thank you very much. Simon, is that from Singapore? Is that something you would like to take up? Or Mansoor, who also has a lot of experience with
for Singapore, I think mental well-being is an important component now. Particularly, I think this whole COVID situation has put a lot of strain at the community end and also at the workplaces side. For Health Promotion Board, we have already started to look at some of these mental well-being programs through video conferencing, through some kind of web binders that we want to also do with some of the respective groups at the community and also at the workplaces. And I think this is an increasing demand coming from some of these groups, and we are trying to see how we can help them, tie through some of this challenging period that this particular community, and particularly the nurses group, the healthcare workers who are really at the front line, and vulnerable groups who are largely very impacted by this whole circuit breaker situation that we are in. And at the workplaces also, there's an increasing demand of these health programs that they have asked HPB to look at. Yeah, thank you.
Thank you.
I might, sorry, if you don't mind. Yeah, I can comment on the scoring system question. Thank you so much for the question. It's very fascinating phase for all of us, and every one of us is trying to be as much objective as possible to get to the safety measures for our staff. But to be honest with you, as of today, from my humble knowledge, I'm not aware of any clear objective scoring system. So what we have done in the company and in the country, we have identified high-risk groups and we told them to stay at home and work from home until further notice, such as pregnant ladies, parents, those who are taking care of elderly, those with chronic illnesses, with low immunity, those who are taking care of kids up to a certain age, those who are with their kids because of distant learning up to a certain grade. So we have identified certain high-risk group. I can understand we don't have enough evidence as per se that those high risk are more vulnerable, but from historical perspective, we know that their immune system response might not be the best in terms of fighting back the virus. So we've taken that extra measures. Having said that, the rest of the staff who are not within these categories are also being mandated or encouraged to come back to work on a phased approach, provided there are no have symptoms. Then there is the thermal scan. As much as possible, we can do our precautionary measures. Public transport, we are lucky enough to have a very stringent regulations from our government in terms of social distancing across the city, whether it's in the metro, whether it's in the taxi, whether it's everywhere. So that gives us a comfort, maybe as a unique proposition within our country, because we are not a big population, where we can feel comfortable to those scenarios. But in summary, I think to have a scoring system will be an interesting phase in our research at the moment to find out how we can quantify it at the end of the day. But then, as mentioned, we can start with the high-risk groups and then evaluate the rest of the categories, especially when we're going phased approach. This will allow us to find out if anything we have missed, and we can catch on it immediately.
Great, thank you. That's really helpful. And I think Janice from New Zealand, you have some additional information you could provide on this?
I've just recently, a few weeks ago, the Society of Occupational Medicine from the UK released a very good guidance for workplaces and a separate one on guidance for healthcare professionals about return to work. And basically it is risk assessment, red, green, red, amber and green, and it puts it into different categories. So might be useful.
Great, thank you very much. And Wolf has just posted, if you can see on your chat, a APAC white paper on mental health, which I think will be, by the way, all the slides and all this stuff will be put together and sent to everyone. But if you do have resources that you'd like to share, please send it to us. Our colleague Barry will be collating everything and circulating it to you all, and also posting it on our coronavirus channel on our website. So perhaps a question for myself, and please, if you have a question, please flag it up.
We have a question from Dr. Rajiv, Tommy, just so we see that.
Oh, good. So
he says he wants to ask questions, so go ahead.
Yes, please.
Hello. Good afternoon and good morning to everybody. My question is the diversity of the circumstances in which governments and organizations are placed would make it quite a diverse strategy to actually have a common strategy for return to work. What would be the criteria adopted, or is there a possibility of having a common return to work criteria, or would that vary from organization to organization because of the variation in the resources and the strategy for implementing in diverse geographies?
Dr. Ragopal, given Unilever's situation, you've got premises all over the world. Is that something? Have you got like a commonality throughout, or is it more localized?
So what we shared with you is common across all countries and all clusters. So there's a commonality of approach, and we apply exactly the same principles in every country. they don't change. Cases have to come down, deaths have to come down, hospital capacity have to increase, and testing should be available. This is the bare minimum common across all countries.
Right. So like a minimum standard upon,
yeah.
And then at local level, you can build on that if you wish. Is that the situation?
Yeah. And even when you come back, certain things are more common. Social distancing, wearing of masks, and hand hygiene. There's no compromise on this. Yeah. Some people may want to come back with 15%, some with 30%. That's left to the country's concern. But these have to be met.
A question for myself and Wolf, I suspect you probably see if people are flagging questions, which I don't. So please just let me know if we have any others. I mean, we saw on literally on live television yesterday in the UK Parliament, the government minister for business was on his feet and started to mop his brow and thinks he may have caught the virus, and our Parliament has just returned. And it does really raise the question about whether or not we could be in danger at some point of an entire second wave, not just, managing a gradual decline, but actually seeing an entire second wave come about. How are some of you thinking about that at the moment, and any extra steps or anything that you still have to resolve if there was to be a second wave that you aren't there yet? Again, maybe Simon, if you understood my question, are you in Singapore? Are you worried about a second wave, and how would you do anything different? I suppose maybe that's my the succinct question.
Yeah, hi. Tommy, you did ask Singapore, is it?
Yes. Mm-hmm.
Yes. Okay. Yeah. I think we are all worried about second wave, as we have seen in some of the countries like South Korea. They do have this second wave coming, especially when school starts to open up and it hit the school bad, and they had to then close back the school. So Singapore is taking a very, very cautious approach as we slowly open up our post-circuit breaker. As I mentioned, we wanted to be very, very certain of the full testing, and this testing is going to be very nationwide. And as we move the people back to the community and the workplaces, we want to ensure that the vulnerable groups are all fully tested, so that once we fully test them, whether is it using swabbing operations or serology for those people who may have recovered but still have the antibodies in them, we want to test them out using serology and to be very sure that these people are cleared. And we also want to do regular testing. So the regular testing, people who goes back to the community, every 2 weeks, we will also test these special groups like the vulnerable seniors, the healthcare people, and also the selected workforce. So this is to really ensure that we don't get hit on the second wave. All right, and it's going to be quite a strain on the healthcare workers if we don't do this on a very careful consideration as we slowly open up the community and the workplaces. Yeah, thanks.
Thank you, absolutely. And
I may add to that, if you don't mind, Simon.
Yes, please.
Actually, in the company, I know the country is easing up a lot of measures across the board, but within our company, we are in serious discussion to have in place a guideline, maybe by early September, to go back and work from home, regardless of the situation and the number of cases. Looking at 1918 and what happened with the Spanish flu, we don't want to wait until things gets messy with the fall and it's a flu virus season, as well as if the corona is there, then we'll have two enemies in one place. So we are in a serious discussion, and hopefully if our board approves it, we will put in place a return to home back end of August, early September, and maybe keep that until December, because it's only this 2020. Once we are able to pass through it into 2021, I am hopeful that by the time the vaccine is available and the virulence of the virus might become hopefully less, looking from a historical perspective.
Absolutely. I also think that's really helpful. And I think universities are also a very interesting place to look at, because they both have got a permanent staff, academic staff and administrative staff and so forth, And then they also have a wave of students coming in and out. And it's been really interesting to see how universities are having kind of different strategies. But at least in the UK, we're beginning to see a certain commonality where where students are probably going to be working in smaller groups and maybe kept in that group rather than mixing around with lots of other groups, at least for the foreseeable future. And that could be something that might that some workforces may be able to replicate as well. So
hey,
yeah, we're all.
Sorry to interrupt
Yes.
you. I think Janice had a comment once you're ready.
Please. Fantastic, Janice.
Okay, I just thought not so much about a New Zealand strategy, but I just want to talk about how proud we are in New Zealand about how that we have actually managed, and from looking out, we've had very clear direction in the 4 alerts, and I think as a country we're extremely proud of where we are now, but there is still fear and anxiety around a second wave. With us moving to level 1 next week, we all hope it's sort of nearly back to normal anyway, but the border restrictions are going to be the biggest thing that we are going to keep in place, as well as the keeping up the testing as well. So I mean, it's and we haven't had so many guidelines on as you guys have, some of you in the workplaces. I'd say we've had lots of guidelines, very great websites and things like that, but maybe not quite so clear. Like we haven't been doing the risk assessments that I talked about and things like that only for vulnerable workers.
Thank you very much.
I'm proud.
You should be. New Zealand has been absolutely exemplary. So, well, look, we're coming up towards the end of the time now, and 1.5 hours, I think, this has been our longest webinar, and I think possibly one of our very best. And we've had some fantastic presenters and great questions. As I said before, all the content will be collated and circulated. We do have on our Global Center website, we have a permanent feature now of coronavirus resources. And so as you're coming across material, please do send it to us, because we would love to share that and make that available for everyone. Wolf posted up earlier that our award program is continuing, coronavirus or not, and we do have entries now already for all the categories. So please, in fact, now is really the time to, for not just in New Zealand, but all around the world, to showcase the fine work that people are doing. And our award program is a great opportunity to do that. So please look at the process of application. At the moment, we do still intend to host our 8th summit in Washington, D.C. on the 18th to the 20th of November. So all been going well. We hope to be able to still host our summit. We have been conducting which has been referred to again earlier, a home survey of employees in the UK. And I think with the Institute of Employment Studies, I think there's probably a lot of material from there and outcomes from there that are pretty universal. And we are exploring the idea of being able to replicate that survey more wider. And of course, we still have our, for people who are wanting to create healthy workplaces, we have our very successful course. And anyone who wishes to certify their businesses, we have Unilever being one of them and a number of others. Then of course we would be very interested in discussing that with you. So thank you very much. Wolf will be for introducing us. He must be very tired by now. It's very late in Arizona. Thank you to Barry for putting all this together, and for all our presenters and all of you taking part. This has been a really fantastic event. We've had participants from Vietnam, from Myanmar, China, and all the other countries that have already spoken. So this is fantastic, and thank you very much indeed. Wish you a good evening, and for us in UK, the day has only just begun. Thank you.
Thank you. Bye-bye, everybody.
Thank you.
Good day.
Goodbye.
Goodbye. Thank you so much.